I'm joined now by Dr. Robert Eckel, who is conducting the all-important Meet the Expert session on the similarities and differences between the ADA and AHA lipid guidelines. And I know there's really been a perceived conflict that I think has confused a lot of people, but in reality, the message is essentially the same.
Well, the neat thing about this, Dina, is the fact that the ACC and AHA cholesterol guideline was released to the public in November 2013, but not published to the middle of 2014. And it was really a controversial document because for the first time, levels of LDL cholesterol and non-HDL cholesterol for therapeutic recommendations were no longer present. And that's because the clinical trials that led to the guidelines really weren't targeting various levels. So it took a lot of time for organizations like the American Diabetes Association to step forward and say, gee, is this really what we want to endorse? And on December the 24th, 2014, the ADA endorsed the ACC-AHA cholesterol guideline. Now there was one exception. As part of the statin indications were a group of people without heart disease who there was a risk estimator that was utilized. So you pull out your smartphone and you plug in a bunch of variables, including diabetes or no diabetes, and you come up with a risk. The ADA was a little reluctant to endorse that calculator because it hadn't been adequately tested yet. But otherwise, in terms of who should get statins and who shouldn't, the lifestyle recommendations, in addition to the fact that statin dose, meaning high dose, moderate dose, all was endorsed by the ADA. So there are very few differences.
Right, so they're really all on the same page now in terms of that.
I think so, yes, and people should not confuse separate guidelines. The recommendations by the ACC, AHA, and ADA are basically all in agreement.
Okay, and I think that will give people a lot of comfort knowing that because they were a little confused about how to handle things. The other important topic are the lifestyle choices and some of the dietary patterns. Can you discuss those a bit?
Right, I think the dietary pattern is one that's been shown to be beneficial to patients with or without diabetes. And when I'm talking about dietary patterns, we're not talking about good foods and bad foods. Have ice cream and birthday cake at a birthday party for your daughter. This is not wrong. But the dietary pattern, like the Mediterranean style dietary pattern or the DASH dietary program, is really one in which lots of fruits and vegetables, lots of whole grains, complex carbohydrate, poultry, legumes, nuts, and really lean meats and fish really is part of a dietary pattern where there's a need to have an ownership for that pattern. And if you have diabetes, eating complex carbohydrates with breads is not wrong. Your management in your physician's office is important to clarify the two of you working together to make sure that complex carbohydrates are adjusted in terms of medications needed to treat diabetes appropriately. And of course, if you go have that ice cream and birthday cake and you're on insulin, you may need a little bit more that day. But I think this is all doable with the same types of lifestyle recommendations. Don't forget physical activity too.
Absolutely, and they should be encouraging that for their patients as well. What do you think is the main take-home message then for your session?
The main take-home message was, again, emphasizing the similarities between the guidelines. And I think it's important to know for the diabetologist that ultimately there are areas that remain uncertain. Beyond statins, what about other cholesterol-lowering drugs? What about triglyceride elevation? Should patients be treated with fibrates or other triglyceride-lowering agents? All of these questions are unanswered, and the information made available can be utilized to make good clinical decisions. But ultimately, the trials are awaiting the results to these important questions that are currently unanswered. And by the way, there's nothing wrong with setting goals. Those goals are just not evidence-based.
I think even with the unanswered questions, your talk is going to settle a lot of unanswered questions for people.
Well, I hope so. Be practical, be simple, and make sure your patients understand what we're all about.
Dr. Eckel, thank you so much.
They do. Good fun.